republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm sure my back line. I just made the end of the deadline. Is there a motion to adopt the agenda? Right, so motion. Second.
Second.
Any questions on the agenda? If not, roll call, please.
Mr. Adavasio,
Yes.
Mrs. Salapata. Yes. Mr. Barry.
Yes.
Dr. Firster,
Yes.
Mr. Dugas.
Yes.
Mr. Simon,
Yes.
Mr. Messerschmidt.
Yes. The approval of the minutes of September 25th. Are there any questions or corrections? If not, is there a motion to accept the minutes as presented? So moved. Second. Second. Thank you. Roll call.
Mr. Dugas.
Yeah.
Dr. Firster,
Yes.
Mr. Adavasio,
Yes.
Mrs. Salapata. Abstain. Mr. Barry.
Yes.
Mr. Simon,
Yes.
Mr. Messerschmidt.
Yes. The next thing on the agenda is the Health Commissioner's report.
Thank you, Mr. Chairman. You have my written report. And one thing I'm going to add to that is on September 27th, the Ministry of Health of the Republic of Rwanda reported an outbreak of Marburg virus disease, which included healthcare workers. The risk to healthcare workers includes U.S. workers assisting in Rwanda. As of October 2nd, there were 36 confirmed cases and 11 deaths. And that number continues to climb. Marburg virus is rare but highly fatal, a viral hemorrhagic fever caused by one of two zoonotic viruses, and is in the family of Ebola virus. An infected person is not contagious before symptoms appear, and the symptoms include fever, headache, muscle and joint pain, fatigue, loss of appetite, gastrointestinal symptoms, and unexplained bleeding. It is spread through the direct contact with broken skin or mucous membranes with body fluids. It is not transmitted by air. As of October the 16th, the U.S. Department of Homeland Security will be routing passengers from Rwanda to designated ports of entry in the U.S. for health screenings. Those include Chicago, O'Hara, New York JFK, and Washington Dulles. Travelers with a history of being in a healthcare setting will receive a screening, be provided with health education for signs and symptoms of Marburg virus disease, and are to avoid all non-essential visits to any U.S. healthcare facility for 21 days and are to be monitored for 21 days. All other travelers from there that were not associated with the healthcare setting will still need to monitor for 21 days. So, and then if there's any development of symptoms, that will require immediate reporting to the local health district. And then that will begin an isolation period for them. So while there would be increased monitoring. So, and then today, the Ohio Department of Health had stated that some of those initial screenings from the ports of entries, if there are Ohio workers, that they are notifying the local health department so they can assist with the monitoring. So I just wanted the board to be aware of that because there's, you know, a CDC alert and then ODH has just notified us. So we are, we spoke of it yesterday to our emergency preparedness group and are basically going to follow some of the measures that we have spelled out from our 2014 Ebola plans, since there are some similarities between the two viral agents that we're talking about here. So, and then we've asked for a core group within our emergency preparedness group to assist with any modifications that we may need to make to those plans because they are now 10 years old. So that's my report, and I could take any questions at this time.
Are there any questions?
I have one question. It said that we got $50,000 less in this village. For the $50,000 less for the tax inside millage? Is that because of
Oh.
the population? Why is that
It,
so
it,
much less?
it depends on the success of people actually paying their
Their
tax.
taxes.
Yes. Yeah.
When the tax evaluations go up, do we get more funds? Like they just reevaluated everybody's property last year, so we'll get more.
We would.
We did.
Any other questions? Well, is there a motion to accept the health commissioner's report as presented? So motion. Second,
Second,
no other questions, roll call please.
Mr. Adavazio?
Yes.
Mrs. Salapatta?
yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Dubus?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. The next one is the nursing report.
Thank you, Mr. Chairman. You have my written report. I would just like to point out a couple, things in my report. Specifically, there was a visual, graphic that was attached to the report. And the purpose of this was to show, our vaccine uptake. That we've increased our vaccination rates throughout Trumbull County over the last 4 years. We just did the last 4 years, so 2020 through 2024. So the last graphic on this page kind of really shows how much we've increased our vaccine efforts. So I just wanted to commend my nursing staff for assisting with that and attending the outreach clinics and really being a vital part of increasing our vaccine rates in the Trumbull County. And then also in my report, there is it says attached to the copy of the overdose report. That is not part of my report. That was a mistake on my behalf. So I just wanted to point that out, that it was not included with my report at this time. I'll take any questions that you have.
Are there any questions?
Aaron, when I look at your graph here for the influenza.
Mhm.
That doesn't include COVID, that's something that's.
Correct.
Separately.
That's correct, yeah.
What do you attribute the increase in vaccines? You don't have any new locations, do we?
We've increased the amount that we attend. For a while there, of course, COVID put a stop to a lot of the outreach clinics. The particular clinics that I'm referring to are held in West Farmington and Mespo. For a while there, we were only going every other month. We have since increased to attending every month. And, the population there is getting to know the day of the month that we go there, so they've really, have come to rely on us being there when we say we're going to be there.
We do just COVID vaccines, we do
Nope.
flu vaccine.
Yep.
So we,
Yep, we have all the immunizations provided, all children's vaccines are provided at those outreach clinics, in addition to flu and COVID.
thank you.
Any other questions? We have no further questions. There are no section. Nursing report is presented. So moved. Second. I'll second. Roll call please.
Excuse me, Dr. Firster?
Yes.
Mr. Simon?
Yes.
Mr. Adavazio?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapatta?
Yes.
Mr. Barry?
Yes.
Mr. Messersmith?
Yes. The next one is the Director of Environmental Health Report. Chris?
Thank you. I provided a written report. The only thing I have to add is, the EPA was here in the building, this week, and they'll come back next week. We're doing our yearly solid waste survey. Go through that. So everything seems to be tracking in the right direction, so I'll know more at the next board meeting, but things are looking good. But that'll be the only thing I'd have to add, so I can answer any questions.
What do they look for?
They go out to Lafarge, they go out to some composting. We don't have any large generators of Texas waste, but you know, we go through the process. They have their list of things they have to check and we go along with them. So everything seems to be going right, and they're doing file reviews, and so far, so good. So they spend a lot of time looking through files for sure.
Good. Any questions?
Chris, has Lafarge started accepting materials again?
No.
No.
No, I don't see them. Well, I mean, I don't think they know when they're gonna start accepting material. Already, correct. My understanding is they're looking at all avenues, so I don't know if that includes closing, selling. I don't know, so they're in the, but the EPA was there with one of my guys and a couple of the higher ups, there was 4 or 5 of them that went there yesterday. To take a look at it, so, I mean, but nothing's happened out there.
Any other questions? If not, is there a motion to accept the report as presented?
So moved.
Second by
Second,
Kathy. No further questions, roll call please.
Mr. Dubus?
Yes.
Mrs. Salapatta?
yes.
Mr. Barry?
Yes.
Dr. Firster? Mr. Adavasio?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. The next one is the grants coordinator report.
Thank you, Mr. Chairman. I provided a written report. Let me know if you have any questions.
Anything special we should be aware of?
Not this month. Everything's on track, going well.
Or any questions for Ms. Jenna? If not, is there a motion to accept the report as presented? No motion. Second, two. Roll call, please.
Mr. Adavasio?
Yes.
Dr. Firster?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapatta?
Yes,
Mr. Barry?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. The accreditation coordinators report.
Thank you, Mr. Chairman. I prepared a written report for the board. The only thing I would like to add is just today, under workforce development, if you guys have the report in front of you, we are currently participating in the PH Win survey. It's a national survey that we can use to gauge our workforce development performance against other agencies throughout the nation. We are one participant away from reaching our threshold to receive individual level data. We are ahead of the curve right now. So I wanted to go on record and thank the health department for participating in this survey. That is not mandatory, but really helps guide and inform our workforce development plan. So we are definitely moving forward in that one. Other than that, I'll take any questions if you guys have.
Are there any questions? Yes, sir.
Not really a question. And I'm sure you're aware. Reading in Malbaugh, they're doing a lot with that now. Virtual meeting, that's the National Association of Board Health Commission Board.
Oh, okay.
And they're asking participation from all kinds of health boards to try to compare and see how they are doing, what their faults are, what their pluses are, and they're trying to come up with plans. So something you can look into. It's kind of interesting. I don't know if you're on their list. I assume all of us are on their list. Maybe not.
To that,
I'll forward you an email from them.
sure, I'll look into it. The Ohio, I'm not sure how many other states are. Ohio is the only state that compels by law their health departments be accredited, which I'm sure we all know. They did start an accreditation advisory group that I was asked to be a part of, that I did join. And we're in the infant stages of that, developing our purpose, developing things that we would like to bring forward to help other local health districts become accredited in different states and things of that nature. A lot of the other states come to Ohio and ask us how we've achieved accreditation, ask us for examples, what we do right, what we do wrong, things of that nature. Sure. Just haven't done it on a national level. On a state level, we're currently there. I would love to see that information on the national level. Try to bring people together. Absolutely. So thank you. Sure.
Any other questions or comments? If not, is there a motion to accept the report as presented?
So
Seconded by,
second,
roll call please.
Dr. Firster?
yes.
Mrs. Salapatta?
yes.
Mr. Barry?
Yes.
Mr. Adavasio?
Yes.
Mr. Dubus?
Yes.
Mr. Simon? Mr. Messersmith?
Yes. The next one is the health educator. We have a report here. He's not here. Yes, look at it. There's a motion. Yes, sir.
having perused it, I'll make a motion that we accept his report.
Thank you. Is there a second?
Second.
Thank you. Roll call, please.
Dr. Firster,
Yes.
Mr. Adavasio,
Yes.
Mr. Dubus,
Yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Mr. Simon.
Yeah.
Mr. Messersmith.
Think there any board reports? If not, moving on to old business. And this is the variance that we discussed last month. Mr. Shaheda isn't here today. Dr. First, did you visit that property?
Took a look at the property. I tried to call the Ohio Department of Health and find out exactly why. Frank, you may know why there was a 10-foot rule. And you go through the labyrinth of whatever, and then finally they say, I'm sorry, but due to a lot of calls, we can't answer your phone. So I wasn't able to get a hold of the Ohio Department, but I took a look at it.
But in the report, Mr. Yellow said it was 6 feet from the line instead of 10 inches or whatever. 10, no, I mean, we were brought to our attention that it was supposed to be 8 inches or something from the line. And Mr. Shaheda was questioned. But Mr. Yellow said it's what,
4 feet.
6 feet.
Is it 6 feet?
Yeah, 6 feet from the line.
Yeah, so I called Ryan, either Thursday morning or shortly after the board meeting as instructed and asked him to go out and measure. He did. He provided a report. It's about 6 foot from the property. The neighbor called me this morning, and the neighbor also was under the understanding that me and Frank and Doc and the installer were all gonna meet him out there, which I think he was confused, but they went, they measured 6 foot. He called me today. He said he couldn't be at the meeting. He understands it's 6 foot now, and he's talked to the neighbor, the homeowner. And he's fine with everything now. They wanted me to relay that to the board, that he is totally fine with it.
Very good. How far is it from his house?
206 feet.
That's not. That's pretty far. It doesn't, when the kids on it.
There's a
doesn't-
vacant,
It doesn't bother you to sleep when it's working.
but he called and asked me to relay that to the board, so I told him I would.
Okay, well then. You want
So
to,
I would make the motion, I would ask the board to adopt the motion as presented.
so motion, Mr. Chairman, is there a second?
I'll second that.
Roll call, please.
Mr. Adavasio.
Yes.
Mr. Dubus.
Yes.
Mrs. Salapata.
Yes.
Mr. Barry.
Yes.
Dr. Firster.
I'll vote if there can be a discussion afterwards. Cause my brain's not done with this.
No. Okay.
Yes.
Mr. Simon.
Yeah.
Mr. Messersmith.
Okay, Dr. Berger, any comments?
Yeah, I don't think what we've done is right. I think it's wrong, and I don't know, ultimately, it's, as a part of this board, ultimately, I guess it's my fault. That this comes up, only because these variances. We're doing them backwards. The thing should not be installed, covered up, and then we give a variance. We should be giving a variance prior to them doing whatever job they do. And I vote yes in this particular case because I saw the site and it wasn't particularly offensive to the complainant's home. I understand that he might feel that that vacant lot could lose a little bit of its value, but it's really not that obtrusive. I don't agree with the fact that the adjacent owner put that in there the way he did. But I think that if you talk about Yoho, that's probably the only way they could do it effectively. My point here is that this whole thing is sliding through the cracks because of board members and Frank and the inspector and everybody. It's just not being done right. Does everybody understand my point here?
Right, so I can address that. So this is a rarity. We usually do them before.
Okay,
This one was one of those things that they found out at the time as they were doing it.
and in order to avoid this, I'm not telling you what to do, but a suggestion would be, we have installers which are which are, certified or whatever,
Mhm.
with the county.
Mhm.
If every one of them got a letter and said, hey, look, guys, variances won't be given after the fact, then at least we'd be on the same playing field.
But there are gonna be times where it has to be done.
So this
You know,
case.
There's gonna be things that come up where they.
Well, I'm sure there are.
Right, so I don't know if I can tell them, hey, the board's not gonna listen to a variance, that I think you have to listen to it, then you decide. But in this case. The neighbor is correct, the entire, when it was laid out, it was gonna fit. And then because of that addition got all wonky, when they went there to do it and started doing it, they realized, uh-oh, it's not gonna fit. So the option at that point in time is leave holes in the ground and leave the project undone until we can get to the board meeting. Or go forward and ask for the variance after the fact. This is a rarity. It has happened, but generally speaking. I tell the inspectors, and Frank will back me up, I told the inspectors, these things have to be done prior, and they have to be done prior. So I can at least get a look at it before I even present it to you guys. So you're right, I agree with you, it's supposed to happen prior, it can't always happen prior. That makes sense.
I agree with Dr. Purser that I think that we need to make sure that we go to grant a variance. That the person didn't create the hardship themselves. I mean, this was a hardship on this gentleman here to install it according to the 10-foot setback. But we need to make sure that they don't cause their own
I do,
hardship.
yeah, I do, that's why we generally do them beforehand.
I guess that wouldn't be fair either.
Well, I agree with you two gentlemen, but I'm confused as to how something would happen. And it has to, they do it prior to the variance. I mean, I don't understand how it's gonna happen that way. Accidentally, I mean, when they laid it out, even if he put that. Even if that addition had made that adjustment and everything, when they laid that out, they should have caught that when they laid that out. And I don't see any circumstance where they would have to install it and then come back to us. I mean, if they're not meeting the criteria, they should stop what they're doing. I believe, because just like in zoning cases and, you know, when I was on council in Girard, we had the zoning office issue permits for additions and everything else. And it came too close to the neighbor's property and didn't meet requirements, and then. When it was all said and done, the person was hit with the stop work order and ultimately ended up having to remove the foundation and addition that they put on. So I'm not understanding the part about how it's just gonna happen. Sometimes it's gonna happen and they're gonna finish it. When they laid it out, they should have caught it.
I mean, I don't disagree with you there,
That's one of the things.
there are times when you dig, you find things under the ground.
I understand that.
Oh, okay.
What I'm saying is, when you laid it out, you know, you have to know where the property lines are and everything, and when you laid it out, if you're laying it out properly. At least in any construction I was involved in, we stake everything out. And you should know. I think we made our case on what, Keith, and I don't disagree with you, but having a little bit of history with some of this stuff, oops isn't always right on the mark. And if they come to put that grinder in a spot and they get, oh, there's a water line here, a gas line, they almost have to move.
Right.
But yeah, I don't think, we just wanted to make sure, and I think we did get our point across, that we don't want this to become the norm.
Right, but this wasn't involving a utility line, it was a known, which should have been known. A known property line and a known problem when they laid it out. If they laid it out properly before it.
I thought they laid this one out within the 10 feet, and then they came up.
I mean, I wasn't there, so
Uh.
I mean, they might have come out and said, okay, and went 10 feet from the house,
Uh.
dug a big hole and realized, oh crap, we're only 6 foot from the part. I don't know, I wasn't there, but I'm with you, but that's why these are rare that it happens after the fact.
If I remember the gentleman, what was his name?
Mr. Shaheda.
Remarks when he was here, there wasn't an active survey when they did that. He had the survey done, if that's what I remember correctly.
He did have a survey done, I don't know the order of what was done prior, but he did after the fact, yes.
Well, I understand they have no zoning up there, but. Even in most places, if you wanna, put up a fence, the setback is 1 foot off the property line and you have to show where the property pegs are.
Well, there's no zoning, there's not gonna be a setback. I mean, you don't broke it, you can lay it right on.
Right, but I'm saying is you still have to know where your property line is. There should, your deed, whatever description, property description, there should be pegs or a rock or a tree or whatever the order is.
Yeah, so I guess the point is, this is rare. That it comes up, but it's going to come up, but I don't think we could have a hard line. That we're not going to grant, there's
Well, no, I'm not,
occasionally that's gonna.
I'm not saying that. I'm just confused as to how. I was assuming, and this is probably my fault, when we were granting these variances. That the variances were all being given because they knew that they couldn't fit it in there. I did not,
9 out of 10 of them are.
yeah,
This is the
I did
one.
not know that it was already in and done. And, I'm not talking about taking a hard line, I'm just talking about a common sense approach of. You should be laying this out, and if you run into this problem before you start installing something where it shouldn't be, you better come here and get the variance.
Well, which appears to be the case most of the time, and this is.
Right, I mean, I don't wanna
I don't know.
I don't wanna beat the dead horse here, I'm
Yeah.
just saying.
Okay. Moving on. Declaration for unfit human habitation. Okay, 8769 Rave State Line Road, Kinsman, Ohio.
Okay, so this comes to us from Kinsman, zoning.
So, yeah.
Okay, so this is, you can look at the picture, missing roof, exterior finishes, badly damaged ceiling tiles, walls, gross unsanitary conditions. There's no here, it says the entire structure is in poor condition. So I'd ask the board to adopt the motion as presented. If there's somebody online.
She's online.
You wanna ask her if she wants to talk?
Yeah,
I mean, can you ask her?
there's somebody on the line for 7869 Ray State Line.
Yes,
Oh, how you doing?
good. How are you doing?
Okay, so you just heard what transpired. Would you like to add anything?
No, I didn't know that they submitted this request. Nobody told me anything.
What's your name, ma'am?
Leanna Cheska, I'm the owner.
Okay, you're okay. All right, so ask your question again. I missed it. I'm sorry.
I just said I was never notified that they even submitted a request.
They probably won't notify you that they submitted it to us. That's, you're talking about Kinsman zoning?
Yes.
Yeah, I don't know what their policy is in sending their request to you and us, but it came to us, we do the inspection and then we send it out. So how it generally works is, if the board had declared unfit for human habitation, you would work with the township to see what they want done with it, or see exactly, if they want it taken down, if they want you to get it fixed. Our role here is to do the inspection and then if necessary, deem it a public or a unfit for human habitation. But generally speaking, if the board does that, then you would talk to Kinsman zoning to work it out with them to see exactly what they want you to do. Does that make sense?
Yes.
I'm assuming nobody's living in this place?
No, nobody lives there.
Okay. Okay, do you, and not, so I mean, if I'm in your shoes, I would contact Kinsman and ask them, what they want, or at least inform them of what your plan is for the structure.
Okay.
Okay,
Thank you for participating. Okay, we have a motion. Is there,
No, there's no motion.
no one? Okay, Chris,
Oh,
you recommend,
yes.
yeah, I'd ask the board to adopt the motion as presented.
is there a motion to that effect?
So,
Seconded by
Second,
Kathy. Any questions?
yeah, to the homeowner, for my curiosity, what is your plan for this house?
I use the farmland. I actually inherited it and asked several years ago. I asked Kinsman about burning it down, but I was told I didn't do that.
Okay,
Oh, for their fire department, you mean?
Yes.
Okay. Well, I don't know what they're, you might, when you talk to them again, see, I mean, it doesn't sound like you would mind if it comes down, so maybe. Talk to them and see what you can work out. It sounds like they probably want it down too. But see what they had in mind,
Okay.
okay?
Roll call, please.
Dr. Firster,
yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Mr. Adavasio.
Yes.
Mr. Dupas.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. The next item, the passage of Trumbull County Combined Health District Emergency Response Plan revised.
Yes, so. I think, most board members are aware that we have a long established, emergency response plan for the health district. How to respond to various types of emergency situations. And it was recently revised. Any plan that we have in place, when a revision is made to it, and you can see those on the second page of that write-up. If you go down and, you can see where it says 9/24/24, and it tells you what the, additions were to the plan. So we're asking the board to basically approve the additions / revisions that we recently made to the plan from the September the 24th.
That's appropriate, so moved.
Next, second. Mr. Simon, any questions? If not, roll call, please.
Dr. Firster,
Yes.
Mr. Simon,
Yes.
Mr. Adavasio,
Yes.
Mr. Dupas,
Yes.
Mrs. Salapata.
Yes.
Mr. Barry,
Yes.
Mr. Messersmith.
Yes. The next item is going, citizens comment. No citizen comments. Next item is executive session on pending litigation. Is there a motion to that effect?
So moved.
Second by. Second. Roll call, please.
Dr. Firster,
Yes.
Mr. Adavasio.
Yes.
Mr. Dupas.
Yes.
Mrs. Simon, Mrs. Salapata.
Yes.
Mr. Barry,
Yes.
Mr. Simon, Mr. Messersmith.
Who do we need?
Legal counsel. I don't know, Chris is.
Okay,